Wait, are we interviewing? Is this going yet or no? Okay. So I went to Clemson. Anybody that comes in contact with me instantaneously knows that I'm a crazy Clemson fan. I decided to temper it with just the Clemson tie, some socks, my Clemson belt, but I should have went all out with the Clemson orange shoes. I wear those on clinic day too. I felt I would keep it a little bit more professional for this setting. Coming right out of residency, I was always under somebody else's shadow. I always had to practice somebody else's way. So first of all, I was just excited about being my own attending for the very first time. But the things that made me nervous was going into an office setting for the very first time with different medical assistants, different managers. Now you have a contract to live up to.
Part of the fear in joining a new practice is the fear of failure, and that there isn't going to be the support there that you need in order to start a new practice. And this was very quickly alleviated by an amazing staff, amazing managers, amazing support, marketing, leadership that all stepped in and made this a huge success.
In particular, with building my practice, what has been especially helpful was the communications team, the physician liaisons, and everybody else around the corporate structure of First Health.
The physician liaisons in respect to a provider building their practice is an integral part of that because we are oftentimes one of the first points of contact that a physician will make in respect to introductions to their community, introductions to other providers, whether they be specialists or primary care providers, and we create that link between the communities that provider may serve and the First Health network.
Will typically be included in their orientation schedule. When we first meet, we may provide them with some written materials like the provider directory, our referral guide, some other sheets that are specific maybe to the community where they're working. Then once we've done that, a lot of times the next step will be to take them out on visits. We actually get them in the car and go on field trips and go meet other providers in the community.
The value of taking physicians and APPs on field trips is lasting. It's probably one of the single most effective engagements that physician liaisons have. And oftentimes it's something years later that when we're interacting with long-term physicians who remember the days that they did field trips, they can encourage the new physicians who are just starting to be patient with the process and to pursue the relationship building and the handshaking, because it will always serve them well as they grow and expand their practices.
There's something unique and special about having that personal meeting and getting to know someone for who they are as a person. I believe that who we are as a person is very important in the quality of care that we provide to our patients. And so really getting to meet the specialists and know who they are helps me better communicate to my patients when I'm referring them to a cardiologist, to let them know who is that cardiologist and what are they like and what can they expect.
There's a lot of different providers along the way that have definitely helped me. Dr. Shaloub is a hospitalist here, Dr. Bedini. They both worked to take patients that had no primary care provider and send them right to me. All these different gears that are working within First Health support you on your journey to being a great, robust family physician practice.
They have to learn how to promote themselves. They have to find out what they're comfortable with. And they also have to learn to build relationships, because all of what they do is dependent upon the quality of the relationships they're able to build within their practice, with their staff, among their colleagues, and ultimately in the communities that we serve. There's a variety of ways that we can put them in the public. What I have to do initially is determine whether or not those are methods of communication that fit the provider's personality. We do things like advertise them on billboards, advertise them on grocery carts.
Seeing my face on a billboard is a very odd experience.
They make these great cards for you so patients can read all about you and what your whole story is. Then we had those billboards that were on the highway that every single potential patient going in or out of Rayford would see.
This was a huge, huge endeavor that really built our practice in that initial first few months.
That was really huge in terms of building a practice. But then it's about just reaching out to normal people. You know, while you go and get that cup of coffee, interact with the staff. Let them get to know you. Let them know that you're seeing new patients. And you know, just by doing a small, simple gesture, your reputation goes around the hospital as just a nice guy that happens to see patients and give great care. And so naturally I started seeing more and more family members within First Health come to my practice. And by providing great exemplary care, my patients then turned around and referred their family members to me as well. So now, even with only 10 months under my belt as a family physician here at First Health, I'm seeing all the way up from the child, mother, and grandmother all in my office. And I'm very pleased with how it's been built up.
The practice of medicine is built on serving people, and so building those relationships with people is going to help you go far in what you do and help you serve the community that you're serving. I feel successful when I'm able to see a provider shift from that initial phase of the startup to really growing and getting a lot of patient volume, and seeing that physician become successful is probably the level of success that I feel for them, because it takes a team of people, and First Health is that team of people to make that physician successful.
At first, First Health allowed me to see 3 patients each half day, so I could become very familiar with the system, and that way I was able to lay a foundation that would help me exponentially get better in the future. So once I had all my templates in, my quick text, everything like that, that's when I started to accelerate my practice. So what you want to do is do a nice slow acceleration. So this may be changing it to 8 patients a day, and then 10, and then 12, and then 14, and then poof, then you're at 19 one day. And that's exactly what happened with me at First Health. And then moving forward, you just have to continually evaluate where you are with your career goals and your family goals as well. How hard are you willing to work to reach the goals that you want to? And what is your goal? If the 40th to 60th percentile is where you need to be in order to meet your basic salary, obviously you need to meet that, but do you want to go above and beyond that? Then what you need to do is figure out how many patients you need to see each day in order to make that goal possible.
There are so many tools that First Health has that can help you practice more efficiently within your clinic and grow your practice. With Epic, there are a ton of dashboards that you can utilize to be successful. There's dashboards that will show you your productivity, how many RVUs, so relative value units, that you're getting each month, how many new patients you're seeing, how many established patients you're seeing, what your no-show rate is. And so all of these you can utilize to really get a picture of where you are in your productivity and the quality of care that you provide.
You could look on a weekly basis to see how you're doing on pneumonia shots, what blood pressure patients need to come in. And it really makes it so no patient slips through the crack. And that's ultimately what we're getting here at First Health. We're ultimately getting to getting better healthcare and getting patients back into the clinic when they need to be. Then the communication and the teamwork that you have with your staff makes an exponential difference.
I believe that the success of building this practice is really due to the teamwork that has occurred here. You could be the best doctor in the world, but if you don't have an amazing team supporting you, you're destined to fail. And that team includes so many people beyond just those working in your clinic. It includes the people working in public relations that came up with all the innovative ideas of how to market our practice. It was the people that went and looked for opportunities for me to give talks in the community. It was those who were answering the phones before this practice even opened. And then once the practice was open, it's been my staff that greet each patient with a smile when they walk through the door, that make them feel warm and welcome. And so then those patients then go back and tell their friends, and those friends of those patients want to come here as well. And it's just that domino effect.
So pearls of wisdom that I'd have for you in accelerating your medical practice, I would just say patience. You can't just expect to have a running family practice that has 22 patients a day, every day, the second you start. No, it's gonna be a very slow process. You're gonna hit the middle of the summer and maybe more people no-show than usual. But the key is patience. So welcome to First Health. Welcome to the onboarding process. You're gonna love it here. If you have any comments or questions, please feel free to talk to me, as long as you're willing to deal with a Clemson Tiger.
I'd like to welcome you as a provider to First Health of the Carolinas. It's an exceptional organization to be a part of. It is focused on provider well-being. It is focused on an overall understanding of the needs, not only that you have, the staff in your clinic, the supporters at a management level and administration, and also the family and the friends that you are going to begin to build and expose to the community that you've come to join. So we're excited that you're here. We're available for you in any way.
We're really glad you're on the First Health team and you've decided to join us. It's a great journey to be on. There's a lot of opportunity with First Health, so welcome, and we wish you all the success. We are here for you. Don't hesitate to call on us.
We're so excited that you're joining First Health. If you have any questions, seriously, reach out to us.
Yes, we mean it.